Pneumonia is a serious lung infection. It affects the tiny air sacs in your lungs, called alveoli. These air sacs become inflamed and filled with fluid, making it hard to breathe. Pneumonia can range from mild to life-threatening. It can affect anyone, but it's especially dangerous for young children, older adults, and people with weakened immune systems. Understanding pneumonia is crucial for early detection and treatment. If you suspect you or someone you know might have pneumonia, seek medical attention immediately. Pneumonia can be caused by various germs, including bacteria, viruses, and fungi. The most common cause is bacteria, particularly a type called Streptococcus pneumonia. Viruses, like the flu virus, can also cause pneumonia. Sometimes, pneumonia can develop after a cold or the flu. Less commonly, fungi from the environment can also cause pneumonia. This is more likely in people with weakened immune systems. There are different ways to classify pneumonia. One way is based on where you got the infection. Community-acquired pneumonia is caught outside of hospitals or healthcare facilities. Hospital-acquired pneumonia develops during a hospital stay. Another way to classify pneumonia is by the germ causing it. Bacterial pneumonia is caused by bacteria, viral pneumonia by viruses, and fungal pneumonia by fungi. Each type may have slightly different symptoms. Common pneumonia symptoms include cough, fever, chills, shortness of breath, and chest pain. You may also experience fatigue, muscle aches, and headaches. Treatment for pneumonia depends on the cause and severity. Your doctor will determine the best course of treatment for you. Bacterial pneumonia is typically treated with antibiotics. Viral pneumonia may be treated with antiviral medications, but often the best approach is rest and fluids. In addition to medications, other treatments might include oxygen therapy and breathing treatments. Nursing care plays a vital role in managing pneumonia. Nurses monitor vital signs, administer medications, and provide respiratory support. They also educate patients and families about pneumonia and its management.